I stayed in hospital for 1 month, include 1 week in intensive care unit, 1 week in high dependency unit, and 2 weeks in general ward. Later on, I was discharged, and 3 months later, my surgeon deemed it necessary for me to have chemotherapy and radiotherapy after having regained from the surgery, which took a toll on me. So I did my treatment between August and October 2012, 8 months of extensive chemoradiation. I used to do 1 chemo session per week and 5 radio sessions every week. So for 1 chemo session, I'll do 5. This was because cancer of the esophagus is one of the deadly cancers, and so also the treatment that accompanies it has to be extensive. Since completion of my treatment in October 2012, I've been going for regular checkups with both my surgeons at Kijabe and my oncologist at Cancer Care Kenya. I see my oncologist, Dr. Vijay, every 3 months, and I also go to theater after every 6 months for post-esophagectomy OGD. This is to ensure that the area where surgery was done is healing well, and also there are no other complications such as infections, bleeding, and leakage. Apart from that, I have also done 1 post-esophagectomy CT scan to see whether any of the treatments that I had has affected any of my internal organs. Luckily, all my internal organs are functioning well. I only have a challenge with the surgery that I had because my digestive system doesn't have nerves, and because they resected a big part of my digestive system, I'll have to deal with a condition known as dumping syndrome for the rest of my life, which includes, makes my sugar levels go down. So if I stay for long without eating, I start feeling dizzy. Initially, I would faint, but with time, I've come to know how to manage it. So I always ensure to carry glucose with me and anything to bite whenever the sugar levels start going down. And also because digestive system is also directly, or I can say indirectly, connected with the excretory system, I don't eat much. And also passing stool sometimes is a problem because of the fact that food travels faster since the system was reduced. The message I would love to tell people, especially those that have just been diagnosed and they are confused, they don't know what to do, the best thing and the best place to seek for treatment is the hospital. I know there are so many misconceptions surrounding cancer, that it is as a result of witchcraft, that it affects only a certain age group, but that is not true. So get the facts right. Visit centers like Faraja Cancer Support Trust, Africa Cancer Foundation to know the right thing to do. Follow what the doctors are saying, and don't be discouraged. Even when you're going through the chemo and you see your hair falling off, you are going through the radiotherapy and you always feel tired, you are always feeling nausea, you are always vomiting, there is always light at the end of the tunnel.
I'm a Goodwill Ambassador of Faraya Cancer Support Trust here in Kenya, and I'm also a therapist in this institution. I am providing music and dance therapy sessions once a week on Mondays from 2 to 3 p.m. And I have already get into my list of beneficiaries, almost 150 patients. I highly encourage everyone to get close to Faraya Cancer Support Trust and give any talents or any kind of good wish and energy to this institution. Thank you very much.